Aginalxic 500mg Safe and Effective Usage Guide. Aginalxic 500mg is a quinolone antibacterial medication that inhibits bacterial DNA synthesis. It is used to treat urinary tract infections, lower respiratory tract infections, gastrointestinal infections, otitis media, sinusitis, and pneumonia. Important note: Aginalxic 500mg can cause side effects, so it is essential to use it as prescribed by a doctor and follow the usage instructions below for safe and effective treatment. Side effects: common nausea, vomiting, diarrhea, abdominal pain, headache, dizziness, fatigue, drowsiness, tinnitus, visual disturbances, skin allergies. Less common: hepatitis, jaundice, renal failure, anemia, leukopenia, thrombocytopenia. Side effects: rare seizures, anxiety, hallucinations, allergic reactions, rash, itching, swelling, difficulty breathing. Hypersensitivity reactions: if a patient experiences a hypersensitivity reaction to the medication, the following treatment measures should be taken. Stop using Aginalxic 500mg. Administer adrenaline and glucocorticoids as prescribed by a doctor. Provide oxygen therapy to ensure adequate oxygen supply to the body. Hypersensitivity reactions: closely monitor the patient's condition and transport them to the nearest healthcare facility for immediate treatment. Precautions when using patients with impaired renal or hepatic function, or G6PD deficiency. There is a risk of drug accumulation. Use caution in these individuals and monitor blood counts, liver, and kidney function if using Aginalxic continuously for more than 2 weeks. Precautions when using children under 3 months of age. Do not use Aginalxic 500mg as nalidixic acid has been linked to weight-bearing joint degeneration in immature animals. Direct sunlight: avoid direct sunlight while taking Aginalxic 500mg to minimize the risk of unwanted skin reactions. Precautions when using driving and operating machinery. Aginalxic 500mg can cause headache, hallucinations, and seizures, so caution should be exercised by drivers and those operating machinery. Precautions when using pregnancy. Nalidixic acid crosses the placental barrier. Studies have shown a link between nalidixic acid and the risk of birth defects in fetuses. Therefore, Aginalxic 500mg should only be used during pregnancy when absolutely necessary, and a careful assessment of risks and benefits should be conducted. Precautions when using breastfeeding. Nalidixic acid is excreted in breast milk. Caution should be exercised when using Aginalxic 500mg in breastfeeding women. Consult a doctor about temporarily discontinuing breastfeeding while using the medication. Drug interactions. Aginalxic 500mg can interact with other medications, reducing their effectiveness or increasing the risk of side effects. Inform your doctor about all medications you are currently taking, including prescription drugs, over-the-counter drugs, vitamins, and herbs, to avoid drug interactions. Dosage and administration. The dosage and administration of Aginalxic 500mg are prescribed by your doctor based on your condition, severity of the disease, age, liver and kidney function, etc. Follow the doctor's instructions carefully and do not alter the dosage or administration method without their consent. Storage. Store Aginalxic 500mg at room temperature, in a dry, well-ventilated place, away from direct sunlight and out of reach of children. Note: the information provided about Aginalxic 500mg in this article is intended for general knowledge and should not be considered as a substitute for professional medical advice. Always consult with your doctor or pharmacist for accurate advice on using Aginalxic 500mg. Note: do not self-medicate without a doctor's prescription. Using medications correctly and following the doctor's instructions is essential to ensure safe and effective treatment.